The readings for today provide an introduction to the policy cycle for health sector reform. In the next two lectures, we're going to be exploring the aspects of the cycle in greater detail. In its ideal form, the process of policy change moves through a cycle of 6 stages. First, the problems are defined, then a causal diagnosis is made, then the plans are developed, then a political decision is made on reform initiatives, then the reforms are implemented, and finally their consequences are evaluated. The cycle then begins again as new problems arise that must be addressed by policymakers. Of course, in the real world, reform rarely takes place according to this simple model. Instead, it begins in different places and skips stages, or several stages can occur at the same time. Step 1 is the problem definition. This is often overlooked, but it is one of the most important stages in health reform. The group that succeeds in having its problem definition accepted has the greatest effect. A problem should be defined in terms of outcomes. For example, the health status of citizens, citizen satisfaction, or financial risk protection. Problem definition and health reform priorities are usually based on value choices. Many begin the reform process not with the outcomes, but with their favorite solution. Problems should be defined in terms of clear outcomes or health system performance goals. In order to identify potential solutions to improve performance, the assessment of health system performance requires a diagnosis of the causes of poor performance. The method of diagnosis will be discussed in the next lecture's readings. This book, the term control knob is used as a metaphor that refers to adjustments in the health system that usually can be made by government action. Control knobs that will be discussed are financing, payment, organization, regulation, and behavior. Together, these 5 categories or knobs cover the mechanisms and processes that healthcare reformers adjust to improve system performance. The control knobs have an effect on intermediate and final outcomes in the system. Efficiency, quality, and access are often considered to be final goals or objectives. In this case, they're more appropriately defined as intermediate outcomes. Step 3 is policy development. This is a very critical step in the process. We all know that new ideas are rare. We know that we're creatures of habit and assumption, and often new policies and reform doesn't happen until a crisis takes place. The sources of ideas for policymakers at that point are looking at what others have done in the past and what they are currently doing in other situations. We are also, as policymakers, looking at innovations outside of the health sector that can be applied into the health sector. And sometimes policymakers look at theory, they look at economists for help, for example, to inform them in the development of new policies. To remind you, reform plans must be technically sound and politically feasible in order for them to be successful. Take a look at this slide. This is an example of a situation that could be technically sound but not politically feasible. In the health reform process, politics matters throughout the policy cycle. Organized interest groups are key actors in the political decision. The future and the unorganized groups tend to be underrepresented in the process. 2 ingredients needed for success in healthcare reform are political will, the political commitment and risk-taking, and political skill, political strategy, and coalition building. Even when a claim is purely technical, there are ethics involved. 3 major ethical perspectives are utilitarianism, liberalism, and communitarianism. Utilitarianism is the most widespread approach to the problem of making ethical judgments about the performance of the health sector. The kind of reasoning behind subjective utilitarianism reflects a view that health is not a special good, but is just one more commodity that citizens buy or not as they choose. The problem with subjective utilitarianism is that it can easily lead to the conclusion that we should not provide costly services to the poor since they would be unable to pay for them. Objective utilitarianism is where decisions are based on individual well-being being defined in objective terms by a group of experts. The difficulty with objective utilitarianism, complicated task of making reliable predictions. The big question is, how do you measure well-being? Libertarians want the state to have only the limited role of protecting individual property rights and personal liberty. They usually oppose actions that restrict individual freedom of choice. Egalitarian liberals argue that the right to choose is meaningless without adequate resources. They argue that respecting others as moral actors requires us to provide them with the preconditions that make meaningful choice possible. For example, someone who is starving, homeless, uneducated, and ill does not have much opportunity for meaningful choice. The question there is, which rights do people have? Communitarianism takes the perspective of the community. This theory argues that the character of a community depends on the character of the individuals who compose it. Therefore, the state should ensure that individuals develop good character and help produce a good society. The big question there is, what are the boundaries and values of the good community? Just keep in mind that health sector reform, like all policy reform, is a profoundly political process. Keep in mind that problems defined by policymakers as issues for public attention may not be those that the experts identify as unsatisfactory or high priority. Mass media, for example, plays an important role in shaping the cycle of issues for public debate. The availability of proposed solutions also affects the definition of the problem. This is why political timing is key. Political timing is important because the window of opportunity for policy change is often limited and subject to unanticipated events. 4 factors are important in understanding how to manage the politics of health reform. Players, the set of individuals and groups who are involved in the reform process. Then you have power, the relative power of each player in the political game. Then position, the position taken by each player, including whether the player supports or opposes the policy. And finally, the public perception of the policy is also an important factor. Assessing these factors is necessary in developing a political strategy. Stakeholder analysis involves understanding the social groups that are seeking to move the government in a particular direction, including private business and non-governmental organizations. Another part of this involves examining the bureaucracies and the competition among agencies and individuals within government. The stakeholders relevant to health reform include both those outside the government and those inside the government. After coming up with a list of players, the next step is to estimate the power and influence of each player. Political resources come in 2 forms, tangible and intangible. Tangible resources are easy to quantify. Money and organization types of resources are examples of tangible resources. Intangible resources include information on the policy and the problem, as well as the relevant expertise which allows the development of a position. Groups whose members have access to key decision makers do better than those without connections to power holders. Health reformers also require the skill to manage the lobbying process. In closing, health sector reform, like all policy reform, is a profoundly political process. Uwe Reinhardt is a professor and economist at Princeton University, and he's been involved in healthcare reform in the United States for many years. He says this about healthcare reform: every nation's healthcare system is a reflection of that nation's basic moral values. Once a nation decides that it has a moral obligation to provide healthcare for everybody, then it can build a system to meet that obligation.